is that with this little bit of time that we have, and I know my hospital and other hospitals are actively working on this, that we at least have an ethical framework whereby the frontline clinician in the middle of the night is not the person who is making this decision, that there are sort of rules that shift over time depending on availability that at least allow us to feel like we're working as part of a team. With that being said, now I am familiar with limited resources, with transplantation, these sorts of things, but a ventilator and an individual sitting there is something that I'm not yet prepared for.
Yeah, it's so excruciating indeed. This briefing, by the way, we're told is about to begin, Dr. Randy, but the Coronavirus Task Force, we're told, is reconsidering whether it will recommend that Americans wear masks. Would you support that recommendation right now if there were plenty of masks available and it wouldn't detract from the masks really going to the frontline physicians and nurses and medical technicians?
So it's the second part of your sentence that I think is so important. We don't currently have adequate masks for our doctors, nurses, paramedics, police officers, and other frontline folks that are in front of the public constantly and getting sick at alarming rates. Were those masks fully available? Sure, having the average person wear a mask is not going to hurt and may help, but the reality, Wolf, is we don't have enough masks for the people that are in the hospitals or in ambulances right now. And so to tell the American public to wear those masks when we don't have enough for the folks that are out there treating patients, to me that makes me nervous, and it's going to put my healthcare colleagues potentially at greater risk.
Yeah, that's a huge problem. What do you think, Dr. Lummis?
I entirely agree with what Dr. Redman says. You know, there are things that Americans can do on a daily basis without wearing masks to keep themselves safe. We know that hand washing can reduce the rates of transmission. Coronavirus is spread by droplet and contact, and we can prevent both of those things without detracting from the masks that are available for healthcare workers.
Dr. Lummis, do you have enough personal protection equipment right now? Do you have enough critical equipment right now to do the job that you anticipate unfolding very soon?
We do right now. I mean, already we've seen changes. A couple of weeks ago, I used a different N95 respirator in any room that I walked into with a coronavirus patient or patient being evaluated. And now we have one N95 respirator for the day. That being said, there's a new supply coming into my hospital shortly. We're getting refit tested. So this is an ever-moving target. There's constantly change. And I do feel like I have the equipment I need now.
Dr. Lummis, Dr. Randy, on behalf of all of our viewers, thanks to both of you for what you are doing. You're saving lives. Thank you very much for joining us.
Thank you for the time.
Thank you, Wolf.
All right, and stay with us. Once again, we're standing by for the start of today's coronavirus briefing over at the White House. We're told it's about to begin. We'll also take you to New York, where a Navy hospital ship is getting ready to receive patients.
Spectrum Mobile is a better way to mobile. First, we deliver the fastest overall speeds and the most reliable mobile service, coast to coast. Now, we're bringing you 5G. And it's only going to get better.